Hello all, today I'm going to talk to you about how you or your child can get back to sport and recreational activities. It's very important when returning to these that you not go it alone. As a minimum, you need the advice of a family doctor. But the family doctors vary greatly in their knowledge of concussion best practice. It's much better then for you to consult a qualified healthcare practitioner. For example, a sports doctor or a PT who is knowledgeable about the most up-to-date concussion practices. Regardless of age, risk assessment is vital, but there is no one-size-fits-all to risk. There are many factors that need to go into a good risk assessment. These include the number of previously diagnosed concussions and concussion-like events, how severe the patient's concussions were and how long they lasted, the degree of control the individual has during the activity or sport. For example, during rough and tumble play, children have very little control of what happens to them next. Another example, team sports are generally considered riskier to return to because the individual has less control than during on a one-on-one sport. Moreover, some sports are much riskier than others. The gender of the individual and the age plays a factor too. For example, teenage females are at greater risk of long-term injury and consequences than males of the same age. Next, the person's demonstrated ability to get back to school or work. And finally, the presence or absence of other physical, cognitive, and psychological issues. For acute injuries, you or your child should never return to any kind of physical activity on the same day the incident had occurred. This is because symptoms can take a while to develop and the risk of lasting damage is much higher. So, if in any doubt, sit them out or yourself. This is to avoid the dangers associated with a second impact. For the following 7 steps, there needs to be a minimum of 24 hours between each step. There is no maximum period between each of these steps. It needs to be determined on a case-by-case basis. Progressing needs to be done by consulting a qualified healthcare practitioner. So, step 1. For acute injuries, start with a period of 24 to 48 hours of relative rest. Step 2. The concussed person should resume their typical physical activities. Step 3. The concussed person may start to slow to medium-paced walking and or stationary bike workouts. For more chronic conditions, the person may already be starting at this level 3. Now, step 4. The concussed person can start sports-specific and recreational activities. For example, those involving running, training drills, and changes of direction. The next steps should only be started if there are no symptoms and no issues in cognition both during or after activity. So, step 5. The concussed person can start non-contact activities that require higher intensities of coordination and increased thinking. For example, passing drills, multiplayer training. Step 6. The concussed person can start activities that could involve full contact. For example, normal team practices. And the final step 7, the concussed person can return to sport. Prior to embarking upon this final step, written readiness for full return to sports should be provided by a qualified doctor rather than a PT. While these general recommendations are a very good foundation, they can be very tricky to apply when it comes to returning a child or youth to activity or sport. To supplement the general recommendations, I'm providing you with the following resources. First, to returning children to activity. McMaster University's CAN Child has a well laid out and straightforward guideline for children. The CAN Child outlines 6 distinct stages. It includes when to move forward to the next stage, but also when it's best to move the child back to the lower level. The first 3 stages can be done while the child is returning to school. However, CAN Child recommends that the latter stages of returning to sport wait until the child is fully and successfully back to school. Next, returning a youth to sport. Parachute's return to sport strategy lays out 6 stages. Parachute has some very useful additional resources, for example, a series of sport-specific return to sport guides. Finally, it has separate guides for parents, physicians, athletic directors, coaches, and teachers. Well, that's all for today. Keep on healing. October 30th, 2025.